Good morning, my friends. If you thought that COVID couldn't get any gayer at this point, like I did this morning, you were mistaken. This is out of Jakarta. This is interesting. The point here at the end we'll get to is that COVID doesn't look like it's transmitted through gay sex in the hospital with a positive patient. This is in Jakarta. This says a nurse was arrested from the military. They're saying a nurse is investigated, but as we'll see, both the patient and the nurse who had a gay sex encounter in the hospital bathroom, were arrested by the military. It says a male nurse is under investigation after a COVID-19 patient revealed on Twitter that he had had sex with the healthcare worker in the hospital bathroom, sharing a photo of the nurse's PPE littering the floor of the Wisma Atlet Emergency Hospital in Jakarta, Indonesia. And then you have the screenshot here of the tweet, where a link, an embed of the tweet, and there are 4 photos. He took 3 screenshots from the texts, supposedly to his friend, telling the people, look what I just did with this guy I met, and then a photo of the PPE on the floor of the bathroom, because the nurse came in, went to the bathroom with the patient, got it on, and then couldn't put the equipment back on, so they left without it. A couple things there. One, do you think the nurse is wise not wise to engage in any of this to begin with, but do you think that they're thinking clearly when they're doing it with the patient who is positive for COVID? They say the regional military command, as the manager of the Integrated Joint Task Command for the operation of Wisma Atlet Emergency Hospital, immediately conducted a search. The identities of the nurse and patient were discovered and both admitted to the sexual interaction. Can you imagine our military getting involved for some gay sex being had in a hospital? Military would do nothing else but just investigate their own hospitals. Then immediately asked to do the PCR swab test, that's a joke, come on, before being handed over to the police. Quote, the healthcare worker is negative, while the patient is still positive. Okay, so again, the healthcare worker is negative after having gay sex with the positive patient. However, only the nurse was handed over to the Central Police for further legal proceedings, since the patient is still positive for COVID-19 and needs to undergo isolation. Back in your quarantine. Doesn't make a lot of sense if you've already violated if you broke your quarantine, you can't just go back and resume it, right? Because you've broken it. You broke the seal, so that seal's no good. You have to restart. I'm sure he broke more than a seal. It is true that there has been a suspected incident of same-sex relationship between a health worker and COVID-19 patient at the hospital, said a spokesman for the National Nurses Association in Indonesia. Quote, our response from the Indonesian National Nurses Association is that the alleged nurse must follow legal processing. I don't know what legal processing there is. I don't know if being gay in Indonesia is a crime, but you would think there is some kind of crime with breaking a quarantine as a health official, or maybe misusing or abusing your position as a health authority. Maybe he came in and told the guy, hey, I've got the secret cure. I've got the vaccine. You've just got to let me administer it. I don't know. This is all crazy. But I thought the first video today should be a little silly, and this certainly is, right? I mean, can you imagine? You're a nurse, you're a healthcare worker. In the United States, people hate you because you made a TikTok video. We should hate you for making TikTok videos while you're on the clock, milking the entire economy dry of all of its resources because we need to fund this emergency pandemic, and we need to, make sure that we give billions to the healthcare corporations so that they can continue to, fund your hourly TikTok videos. Well, I'd rather have the TikToking nurse than a dick-docking nurse, somebody who's going to go and have a bunch of gay sex in the hospital with the COVID patients and then not get it themselves. That's the interesting part here. That's why I wanted to share this. Not because I'm some homophobe, but because I think it's interesting that wearing a mask will save you from COVID. Some people believe different prophylactic medications can save you from COVID. Or just go fuck one of them in the bathroom of a hospital. Apparently, that is not going to get you COVID anyways. So, very strange. I don't know how transmissible this virus is if you can't even get it from that. So let me know what you think in the comments. Like the video, share this video, send this video to your friend who's a nurse, and ask them what they've been up to lately. Ask them where they were. Ask them if they have been to Jakarta. Ask them where they were on Christmas Day. And then do everything else that you can do to keep yourself afloat and to keep America afloat.